Hello, and welcome to Boston Bone and Joint Institute. If you're watching this video, you may have a few questions about your crutches. There are many alternative brands and models available that will help you to achieve the same goal, but these aluminum crutches are the type we prefer. Boston Bone and Joint Institute bills a durable medical equipment item to your insurance company. Please contact your insurance company for your benefits or contact our office for additional information.
Crutches are a commonly used assistive walking device utilized to limit or prevent weight bearing following a lower extremity injury or surgery. You should never progress your weight bearing status without instructions from your provider. You'll be provided with a protocol that will detail your weight bearing progression, length of use, as well as any additional restrictions. Having the correct size crutches is crucial for a safe and efficient ambulation throughout your recovery period. You may notice your crutches have a height guide approximation on the lower portion of each crutch. This is a guideline. Oftentimes, crutches are adjusted to a different setting to accommodate your individual needs. To check for proper sizing, or if you feel your crutches were not properly sized, first adjust each crutch leg to your approximate height by pushing in the silver button. While the button is pushed in, pull out the leg extension to make the crutch longer, or push the leg extension in to make the crutch shorter. Place each crutch under your arm and grasp the hand grip. An appropriate fitting crutch will allow for a 2 to 3 finger width space between the top of the crutch and your underarm. You should also have a slight bend in your elbow when gripping the handle. You should never have direct pressure on your shoulders or underarm area from the top of the crutches. If you feel hunched over while ambulating with the crutches, it is possible the crutches are too short. To fix this, extend each crutch leg a notch or two and recheck for height. You should stand upright and look ahead of you while ambulating and not looking downward. If the length of the crutch is sized correctly, but your elbow is completely straight when grasping the hand grip, most likely the hand grip is too low. To fix this, loosen the wing nut and remove the screw that houses the handle. Slide the handle up and reinsert the screw. Reattach the wing nut and tighten. Lastly, check to see if the elbow angle has improved, allowing for a slight bend. There are generally 3 types of weight-bearing statuses utilized with crutches: non-weight bearing, touchdown weight bearing, and partial weight bearing. While ambulating, you should always have a good supportive shoe like a sneaker on the non-injured foot. You should never wear a flip-flop or slide-type sandal. Prior to movement when ambulating at any weight-bearing status, you should first stand with your crutches and hands firmly on the grips. The feet of the crutch about 6 to 12 inches away from the outside of your feet. Generally, this is a little further than your shoulder width. When you move the crutches forward, they should be moved about 6 to 12 inches. The taller you are, the further out your crutches may be. It is best to take smaller steps at first until you are more comfortable. For a non-weight bearing status, you are applying no weight to your injured limb. To ambulate, first bend your injured limb side at the knee, either in front or behind you. Leave your non-injured foot on the ground and move your crutches forward. Lastly, move your non-injured foot off the ground and swing forward to meet in line with your crutches. For a touchdown weight bearing status, you are touching the injured limb on the ground. The purpose of this is for balance only. The majority of your weight should be applied to the non-injured limb. To ambulate, first slightly bend your injured limb side to slightly touch the ground. Leave your non-injured foot on the ground and move your crutches forward. Next, move your injured limb to meet in line with your crutches. Lastly, move your non-injured limb off the ground and swing forward. Your foot should land in line with your injured limb and crutches. For a partial weight-bearing status, a percentage of your weight may be applied to your injured limb. A common progression may include 25%, 50%, and 75%. The best way to determine this is by weight shifting on a scale in order to get a feel on how much weight you may apply. You will be given a detailed protocol from your provider detailing how much weight you may apply and how quickly you may progress. You should never apply more weight or progress your status without instruction to do so from your provider. To ambulate, first slightly bend your injured limb side to slightly touch the ground with the predetermined amount of weight from your provider. Leave your non-injured foot on the ground and move your crutches forward with your injured limb. remember, your injured limb and crutches move together. While balancing with your crutches and injured limb, move your non-injured limb off the ground and swing forward. Your foot should land in line with your injured limb and crutches.
At some point, you may find yourself needing to ambulate up or down stairs, and with any weight-bearing status, they may appear intimidating. There are 2 techniques you may choose from that will allow you to confidently ambulate stairs with crutches until your provider allows you to walk normally. Prior to ambulating, be sure to have a good supportive shoe on the uninjured foot. You also should stand directly facing the stairs, close to the first step. The first technique utilizes both crutches at any weight-bearing statuses. This may be the more difficult technique to use as it requires a combination of balance and strength. However, it is the best option when stairs do not have a hand railing to use or once your provider allows you to partially weight bear. To ambulate upstairs with a non-weight-bearing status, first place one crutch under each arm and firmly grasp the handles of each crutch. While applying all of your weight through the handles of your crutches, balance on the crutches and step up with your uninjured foot. Once your foot is firm and flat on the step, release the pressure from your arms, transferring all of your weight through your uninjured limb. Lift the crutches up a step to meet in line with your uninjured foot and repeat. For a partial weight-bearing status, your injured limb may stay on the ground to help with your balance. Once your weight is transferred and you are ready to move your crutches, your injured limb moves at the same time as your crutches do. To ambulate downstairs, the order is reversed. First, move your crutches down a step. While balancing on the crutches with your weight through your hands, lift your uninjured foot and place firmly flat on the same step your crutches are on. For a partial weight-bearing status, remember your injured limb and crutches move together. Move your crutches and injured limb down a step. Balance on the crutches and amount of weight as determined by your provider on your injured limb. Next, lift your uninjured limb and move down the step to meet in line with your crutches and injured limb. The next technique utilizes a hand railing. Unfortunately, the stairs you wish to ambulate on do not have a hand railing. This technique will not work for you. This technique is best for patients that do not feel confident in their balance and have a large hand grip. For this technique, place both crutches under your arm on the opposite side of your injured limb. Firmly grip both crutch handles with your hand. Next, place your injured side hand on the hand railing. To ambulate upstairs, apply all of your weight through your hands into the crutch handles and hand railing. Once balanced, step up with your uninjured foot and firmly place flat on the step. Transfer your weight to your uninjured foot. Move your crutches up the step to meet in line with your uninjured foot. Slide your hand up the railing in order to continue ambulating up the stairs. To ambulate downstairs, again, place both crutches under your arm on the opposite side of your injured limb and grasp the handles firmly. Grasp the hand railing firmly with the hand on your injured side. Move the crutches down a step. With all of your weight applied through the hand railing and handles of the crutches, lift your uninjured foot off the step and step down to meet beside your crutch. Slide your hand further on the hand railing and repeat. If you have a partial weight-bearing status, when your crutch moves, your injured limb moves, like above in the 2-hand crutch technique. If the stairs you are ambulating on only have a hand railing on one side, you will need to adjust or utilize the other technique. If the stairs you wish to ambulate on do not have a sturdy hand railing, it is not recommended to utilize this technique. If you do not feel confident with either of the crutch techniques, you may go up or downstairs on your bottom. To go upstairs, first, turn around so your back is facing the stairs. Next, sit down on a step. Place your hands behind you on the step above and ensure your uninjured foot is firmly flat on either a step below you or on the ground. Applying your weight together through the palms of your hands and uninjured foot, push up with your hands to lift your bottom. Move your bottom backward on to the step above and sit. Lastly, move both hands up to the next step behind you, move your foot to follow, and repeat. To go downstairs, sit on the top step of the stairs and extend your legs in front of you. Brace yourself with your uninjured foot firm and flat on a step. Place your hands with your palms facing down on the same step as your bottom. Next, push down with your hands and lift your bottom. Move your bottom forward and sit on the next step. Slide your uninjured foot down a step and repeat. If you have additional questions, please refer to your post-operative protocol, discuss with your physical therapist, or contact our office by phone or message us through the BBJI portal.